So hi guys and welcome back to this session, and today we're going to put our vital signs together as we talked about the last time. So let's get straight into it here. So if you look directly underneath me there, you can see the breathing rate is 12 to 20 breaths per minute, the heart rate is 60 to 100 and the cap refill is under 2 seconds, as I've covered in my previous videos. So don't forget to check them out for a small bit more detail on them again. So let's go straight into it. Now we have a patient here. We'll just say, for argument's sake, the next door neighbour rings your doorbell and says, oh, come out quick, Johnny's collapsed. So we go into the house, find Johnny inside. Johnny is a 70-year-old gentleman, collapsed on the ground, unresponsive, so he's unconscious, not responding to anything. But when you walk in, that the scene is safe, and you notice that the patient's on the ground, and you notice that you can see his back rising and falling, so we know the patient is breathing. So if we get straight into it here, we'll just say, imagine for argument's sake, this is at 10 o'clock in the morning, right? And you go in, you do your vital signs. So the first thing you do is scene safety. You're going to open his airway. The airway is clear. We're not worried about trauma now because it's a medical call that he's at home. So we'll take it then that the breathing rate is 16 breaths per minute. The heart rate is 70 beats per minute. And the cap refill is under 2 seconds. So at that moment in time, everything is looking good, isn't it? So if you're looking at the parameters over here, patient is breathing. Everything is going okay. So we'll move it on slightly then. So we'll take it then that we'll say it's 5. Now you notice that the breathing rate is 17 breaths per minute. The heart rate has gone up to 80 and the cap refill is still under 2 seconds. So we notice then that there's a shift. So the biggest thing with a lot of people is they go along and they do one set of vitals and they leave it alone at that. In my own private vehicle, I carry nothing, only a few bandages and obviously my 10 fingers. You can argue the point whether fingers or thumbs. I'm not too worried about that. But the thing about it is the simple stuff in life that's going to save you. So if you're dealing with, say, you're looking on today, or first aid or EMT, paramedic, advanced paramedic, nurse, doctor, it really doesn't matter. This is the basis of understanding where are we going with this patient now. So if I move it along then, so we'll take it then, we're 10:05, or we'll say 10:10, right? And now we're going up to 19 breaths per minute, and the heart rate is 99, and the cap refill is under 2. So we're looking now, the patient's just on the border of going forward. So remember when we were checking, the heart rate was like this. Nice and steady. Want to be careful too as well with the breathing rates as well. So we're normally looking at people that have a normal breathing rate. Is that normal? Absolutely not. So if this patient was on the ground and they were starting to breathe that way, you'd be thinking, this is not good, is it? So another thing then that's going to happen is now, maybe probably in a minute, is that you're going to hear this as well. So we were feeling for the pulse a minute ago, remember? It was nice and regular. It was nice. So what happens now if it goes this way? It speeds up, doesn't it? Yeah. So if we speed up, and we put them together, now we know the patient is distressed. So at that moment in time then, what are you thinking here, guys? So are we thinking then that, sorry, now I must change the colour of my pen. So when we're looking at the patient now, so we'll take it then that, whoops, my pen has gone slightly missing here, guys. Yeah. 10:15, right? So the breathing rate now is 22 and it's laboured. The heart rate is, we'll say, 110, and the cap refill now has gone above 2 seconds. So now where is the patient? So do you require an ambulance now at this moment in time? The sweetest sound you'll ever hear at any call, and I hear this from patients all the time and from medical professions other than the ambulance service, is this. That's the sound you want to hear coming up the road, isn't it? That's the one, because you're looking for the paramedics, advanced paramedics, EMTs, the trained personnel to come along to help you in this situation. Even though I call myself on off duty, and I love to hear the ambulance coming myself as well, boy, because we can do that bit of more definitive care for the patient. So if we go along then, and we go 10:20, and we'll say the breathing rate now has gone slightly up again. So if we were listening to it now, that's a very fast breathing, isn't it? So if I say that the breathing rate has gone to 40 now, and we'll take it then that the pulse has sped up a bit, gone up to 120, and the cap refill. Now, at this moment in time here, if you're at home, and we'll say most people nowadays, due to COVID, have a thermometer at home, and we'll just say, for argument's sake, the temperature has gone up to 38.9. So we know the normal temperature is 37, roughly thereabouts, 36.6, 37, an argument over a book, nothing major at that point. But at 38.9, it's high. Now, so if you're looking at that, we're looking at this patient probably has an infection on the ground. Remember we were talking about Johnny, 70-year-old gentleman. So if we move it along, say 25, breathing rate is still 40. Heart rate is 140. Now, so you can see it over a period of roughly 25 minutes here, just doing our sets of vitals, what's after happening to the patient. Everything has sped up, hasn't it? So we started off normal. Now, if you went along and you did one set of vitals, left the patient on the ground, kept the patient warm, how are you going to know whether the patient is big sick or not? And this is what I would do and work on a daily basis, and most practitioners do as well. So we'll take it then that you're still waiting for the ambulance, and now we'll say we'll say 10:30. The breathing rate has gone down to, we'll say, 12 breaths per minute. The heart rate has gone down to 55. And the cap refill is still above 2. And the temperature is 38.9. Now, what's after happening is here, guys. So, like, if you look at the parameters over on this side here, the person is starting to drop, aren't they? So, the problem with that is then that the cap refill is still going this way. So the problem with that is now that the patient is big sick, because they're gone through a full cycle of sickness. So if I equate it this way here, we're looking at this. So picture a car going along the road, and you're going down the road at 60 miles an hour, right? And everything is going well. You're in 5th gear, no pressure on the engine, nothing at all. So the next thing you come near an incline, as you know yourself. So a handy incline, then you notice that you might have to drop a gear into 4th gear. And the next thing then, that what happens is the engine rate goes up, the oxygen demand goes up, and the fuel consumption goes up as well. Is that any different in the human body? It's not really, to a point to understand it. Now imagine we're going right up the hill now. We're going up here. We're in a small bit of bother here. Now we're down in 3rd gear. The engine is racing. So even if you look at it around here, so now in around this area would equate to this chap here. The engine is racing. We're pushing hard. We're breathing heavy. We're breathing like that. The pulse rate is going through the roof. Patient's under big pressure now, and as a result of that, now, so the problem is then when we get to the top of the hill here, as you know yourself from running up the stairs or anything like that, you get to the top of the hill and everything starts to calm down a bit. But the problem with that for the human body is then that we've gone all the ways up, and the next thing we're starting to this heart rate, breathing rate then might change a small bit, deep sighing respirations. As a result of that, then what's going to happen next is then that the car can actually go off the cliff, isn't it? As a result of that, then what's going to happen down here then is this. Patient can pass away. Now that's the worst extreme, guys, but that does happen. If you look in Ireland, on an average day, there's 12 to 20 people that drop dead suddenly from cardiac arrest, and in some cases you might find symptoms like that, especially in the lower side there where the figures will be low, with a laboured breathing, something like this, and very slow heart rate, or middle to road heart rate as well. But yet again, most of these patients, any patient you're dealing with in this guys, we need the ambulance coming, don't we? Now, so another thing too is that when we're looking at the parameters here, so remember this can happen, and we'll say in time-wise, for minutes to hours to days, and depending on the patient. So whether it be a medical or a trauma patient, this is the way. So when you're looking at your vital signs, yet again, like you're starting up here, you're looking at, we'll say, breathing rate, heart rate, we'll say breathing rate and your heart rate, and breathing rate and heart rate, and this is called trending. So if you can go along and you can trend, And it doesn't matter what skill level you are. This we can all do at home. So if you watch some of my earlier videos, you can see it. We talk about pulse rate, skin colours, temperature, cap refill. And yet again, when you're talking about a temperature, yet again, if you don't have a thermometer at home, you can just go along, put your hand in the back of somebody's head, and we all know when the patient is sick or not. So just a quick recap on the whole process here, guys. So yet again, when we're going back and we're dealing with our patient here, so remember we started off here, we started off in a graph, and the next thing, everything, the patient started to spike, all the vitals started to rise. Then as a result of that, we were watching the patient away, and next thing, everything started to plummet on the patient. And as you can see, it's going all the ways down, all the ways down. And if we don't monitor vital signs, what can happen is that the patient can start off here and end up here, and you'll end up getting a fright as a result of it. So the thing is, unless you monitor the vital signs, what we showed you, it's not about blood pressures, all that. We need to, this is pre-hospital, this is what we do at home. So the thing about it is, that's absolutely fine. You're going to monitor the patient as best you can and keep on top of it, especially for an unresponsive patient on the ground, like poor Johnny we mentioned earlier on. And as a result of that, if that doesn't work, then unfortunately we're going into this road. And that's not, this is no hand act or part of what we've done. Remember, if the patient is moving this way. So that's why, like, if you're dealing with the patient unresponsive and you measure the vital signs, then you ring back ambulance control, you're waiting for the ambulance, and suddenly you tell the ambulance, look, the patient is starting to deteriorate, and this may move the patient up on a category or two. So another thing you have to be very careful too as well is then when you're dealing with children. So children go along, next thing anyway, they're going along, playing away, next thing suddenly they get an illness and go down, and they get sick, and they get very sick for 2 or 3 days, and they come back up. And if you notice, then they always come back at about 10:30 in the night when you're tired after looking after them for the 3 days, and they want to play. And that's the thing. So remember, yet again, children come into different categories than ourselves as adults, and older people come into the geriatric thing. And that doesn't mean that they've dementia or anything. It's just a category. So it's no different than having a new car that's a year old, a car that's 5 years old, and a car that's 30 years old. Everything starts to wear away, and we're going to do a whole section on pediatrics coming on shortly. Thank you very much for all the support I've been given during the year and the launch of this YouTube channel and our website. And thank you very much to all my customers and my friends for the good wishes from all over the world. And I'd like to wish you and all your family a very happy and prosperous new year. Thank you yet again for the support.